Hey, we got a lot going on TWIRx today. It's Friday, people. You people. Hey, welcome to This Week in Pharmacy. My name's Todd Urey, founder of the Pharmacy Podcast Network. It's April 10th, 2026. You always hear me say it. Time is going way too fast. It's second quarter 2026 already. Excited about what's happening in This Week in Pharmacy. I'm just blown away by the activity this week, the getting ready for Asembia 2026, the Super Bowl of Specialty Pharmacy. We'll be catching up on that. We're going to talk with Nick Baird, probably saying his last name wrong, Nick Bard from Outcomes, marketing director there. Have had a wonderful planning session with the Outcomes team that bring a ton of valuable content. They are joining the Pharmacy Podcast Network. So who's excited about that? Me. Yeah, I'm thrilled to welcome Outcomes to the PPN. We'll be talking with Nick coming up very quickly, but I really review. I have so much news I wanted to review. This would have probably been like a 2-hour TWIRx. But let's get into news. Yeah, I tell you what, Dearborn Heights pharmacy owner, I don't know if you heard about this out of the state of Michigan. Dearborn Heights, their pharmacy owner there pleads guilty to $1.9 million in healthcare fraud. They're going after this pharmacy quickly and fiercely. It's Medicare, Medicaid, Blue Cross Blue Shield of Michigan are going to be part of the case. And this is he could face 10 years to in prison, $250,000 in fees. Just horrible news to hear that. I don't like the negative news in pharmacy, but it is what it is. Hey, over to Pharmacy Times. Better news just came out today, This Week in Pharmacy, how HOPA President Amy Soon plans to strengthen oncology pharmacy amid rapid change. It's in a wonderful video interview with Amy, and it's an opportunity for you as pharmacists that are focused on oncology, hematology oncology through the Pharmacy Association, HOPA, to do something greater and to start getting involved and start reaching out to Amy and her organization and asking how to participate and how to get your name out there and become more influential and more driving of pharmacists driving oncology treatment and care. And I'm excited to hear more about this. It was great to see this come up. More good news came out just today from the University of North Carolina of Chapel Hill School of Pharmacy, the Elshman. You have to say Is it the Elshman School of Pharmacy? Pharmacy teams work towards pediatric brain cancer research breakthrough. This is a wonderful announcement and article. Congratulations to UNC Eshelman School of Pharmacy. They interviewed David Drewy and professor, and they break into what's next and digging through this research and being able to once again get pharmacists tied into very specific disease states and building out expertise, board of pharmacy, board of specialties on the hinges of continuing to build very specific specialties for pharmacies. But this is great news out of the University of North Carolina, Eshelman School of Pharmacy. Congratulations on that. Hey, Outcomes is one of our sponsors today on This Week in Pharmacy. You're going to hear from Nick and excited to work for them. There is a new system I'm not allowed to talk about coming out from Outcomes, and we're going to definitely be talking more about it on This Week in Pharmacy, but I want to dig into how this is going to tie into clinical care, treatment care, developing revenue streams that's beyond the prescription. Extremely excited to be working with this group. Once again, learn more at outcomes.com. Once again, that's outcomes.com. Hey, I want to click over to LinkedIn. Michael Wysong, he's the CEO of Care Pharmacies. And this guy has the most serendipitous ability to run into people. He just posted something last year, which he ran into somebody that was special, just posted not even like 2 months ago. And now he posts again with his travels that he runs in to a famous boxer in the 90s, and just having that run in Troy Dorsey. And, being out when you travel, and if your face isn't just down in your phone, you do have time to look around. There's always opportunity at airports. I've done so much business accidentally or serendipitously through airports. So keep your head up when you're flying around. And Michael, I hope to see you at Assembia at the end of the month in Vegas. Hey, Vince Grippy, he writes a newsletter called The Grip. This is issue 50. Vince Grippy, my buddy over in media, runs Grippy Media. He's brilliant. He does a video series in educating people that are interested in leveraging media in healthcare specifically. But he went into kind of blogging about the New York Times recently published a glowing profile of telehealth startup MedV, framing MedV as a real-life vindication of Sam Altman's vision of AI super efficient business potential. He goes on to say that there's one problem. The company is facing an FDA warning for manipulative marketing, multiple lawsuits and accusations of using deepfake doctors and fabricated testimonials to sell its GLP-1s. And he goes on, in plain human-generated English, MedV, Mo, is a lot of BS. And it's true. All of you marketing directors out there, all of you creative VPs of marketing out there, do not give in to the lull of letting AI generate things that hit differently. Not talking about manipulating your logo. I'm not talking about maybe enhancing a picture of two people that are at a conference, or maybe you want a different angle. I'm talking about using content development through AI to influence the consumer. And how many laws are not even in place yet about the use of artificial intelligence? But this is big. And why? I mean, the GLP-1 market is booming as it is, and now you're just getting greedy, cutting corners, and your compliancy from a marketing perspective sucks. You know who I think of is Dr. Darshan Kulkarni, lawyer, pharmacist, specialist in compound marketing and different things that he's doing. If you want to keep yourselves out of jail, but you want to take it to the edge and you want to build some really cool looking stuff, and you even want to use AI, reach out to a lawyer like Darshan, who really knows the insides and outs of this and will keep you from stirring up issues and problems with the law and with the FDA. Hey, Medtronic, I think they are originally a Pittsburgh company, but they have some big news, and I wanted to share it. All right, so Medtronic is in no way a sponsor of the Pharmacy Podcast Network or This Week in Pharmacy. That is certainly not the reason that I posted that video. This video is posted for every pharmacist, text to, but more of in a supportive role. Every pharmacist out there who hasn't looked into digital therapeutics, who hasn't looked deeper into how technology will become a better tool for you as a consultative pharmacist, a treatment-driven pharmacist. But I want you to pay attention. Even go look at Medtronic, for example. Read up on what they're doing. There's ways to do this on your own. There's ways to do this as a independent community pharmacy. There's ways to do this in the capacity of long-term care and being a consultant. So look into these kinds of technologies and where this could lead you in your career as a pharmacist. Hey, my friend, Marcia Millalong. Marcia is brilliant. She runs the Catalyst Enterprises LLC. She's been an author for absolute years in pharmacy, most on some community stuff. But she posted an article on LinkedIn through Drug Topics that just posted This Week in Pharmacy. And it's the title, The Story of a Pharmacist Going from Corporate to Cost Plus. I absolutely love this story of Greg Jones, who's a pharmacist. He got his MBA. He started in a busy independent community pharmacy. His uncle was involved in that. He experienced pharmacy life in a couple different settings, and then now he is going to head down the road of the cash-based model. He proudly opens a company. Now he's calling his pharmacy Compass Core Pharmacy, Rhode Island's first cost-plus pharmacy model. Just this May, coming up May of 2025. And this is so freaking cool to see that Dr. Kyle McCormick's Blueberry Pharmacy here in Pittsburgh, which was the first, if not one of the first, is really starting to spread across the industry of saying, do you know how much freedom you could have in your business and growing your business and serving your community if you could start a cost plus pharmacy where you're taking cash only, or you're coming up with payments systems through your services or club memberships or whatever it is. But look into the cost plus model. I've even heard of independent community pharmacies who own more than one location, running one as the traditional insurance taking pharmacy, running the other one purely cost plus. And it gives some padding, obviously, to the overall overhead and operations. But I want you guys to look into that and the freedom that could come from cost plus. There is no slowing down of the cost plus models. We know, and you know, what's happening with Mark Cuban cost plus drugs and the growth that they have and the excitement. We have great interviews today, Nick. And if you've ever heard of the Health Wagon, not sure if you've heard of this, but this is a very special story about a pharmacist dedicated to her community. And there's no money in the community. There's no ability to pay for medical services. And this 100% free Health Wagon model is absolutely incredible. What an incredible story. All this coming up on This Week in Pharmacy. Hey, welcome to This Week in Pharmacy. As you can see, it's a fun Friday because I get Nick Bard in the studios with me from the AFC North rival of the Pittsburgh Steelers. You are a Cleveland fan.
I am a Cleveland fan, but I will say I grew up in Youngstown, so that's the borderline of either you root for Pittsburgh or Cleveland,
Yeah.
and I guess unfortunately I'm rooting for Cleveland.
Well, one of our greatest customers, been customer for 4 years, Ural Pharma, Steve Beckman. He loves the Cleveland brownies, and it's just like every time he comes over, he sees the accent colors at the PPN are all about the black and gold.
Yeah.
So he has to put up with it. So now you have to put up with it too.
Yeah.
Hey, I'm excited that you're here. Really excited about the announcement. I'm gonna kick it over to you to kind of talk a little bit about it. But I have been working with Outcomes on and off for a little while. We did um, the big conference for Syncora last year, ThoughtSpot. That was freaking awesome.
Yeah.
Like we had such a good time.
I had a blast.
But you and I have been becoming friends in the industry now, and you guys are joining the Pharmacy Podcast Network. So I am thrilled about that.
Yeah, we're excited. And, we got a really great opportunity to work together last year at Syncora. And I really think that we got a chance to get to know each other both personally and professionally. And seeing all the work that you're doing to help drive independent pharmacy forward really pairs naturally what we're trying to do and build within our outcomes community as well. So we're excited about it, and we're looking forward to continue working with you in the future.
Yeah, I'm excited too because there's so many stories that we can jump into. I can't wait to get into artificial intelligence and workflow. I can't wait to talk about the automated data entry. We actually just recorded recently with your associate Dalia Rios an episode of RX30 Unscripted. I cannot wait for you guys to hear that because this digs deeper. But having these kind of resources is important to the network. The network is about bringing content to one place, so you're not all over the place. There's 5.2 million podcasts out in podcast land. The Pharmacy Podcast Network takes the pediatrician, takes the senior care, takes long-term care, takes pharmacy technology, and brings it right to our listeners. So we are so fortunate. We are lucky to have Outcomes joining the team, bringing us more content about tech. But also, you know what I really like too, Nick, is when our hosts and the people that they bring on, they ask a lot of good questions, so we get the rest of the listeners dialed in to saying, is there a better way to skin that cat? Is there a better way to overcome that obstacle that independent community pharmacies are what they're going through right now? It's a transformation from prescription based focus to outcomes based focus to value based focus to building better relationships with patients. And if technology doesn't suck up the operations, you can't do it.
Yeah, I mean, it really ties back into our vision, right? Where, hey, we want to empower and provide pharmacy the tools they need to run their business every day. But at the same time, providing them tools that will drive optimization through automation and innovation to empower them to get more involved with their community, their patients, and hopefully spend some more time looking at revenue generating opportunities that exist through the broader outcomes network or payer and pharma sponsored programs that we're partnering with. So that is really what our team is driving and pushing for every day is, hey, how do we take these tasks that pharmacists are doing and how do we look at them in a different lens to drive value back into the pharmacy that will help them with profitability, to help them drive optimization, et cetera. So we're really excited about it. And not to mention, yes, Dahlia was here talking about automated data entry. That was awesome. But the other thing is you've spent a lot of time with multiple team members. We had Luann Myers speaking with you, I think recently too, and she was talking about the pill count machine and some of the stuff that we're doing there to build in the workflow. So there's a lot of exciting things happening in outcomes, and we appreciate the time that we get a chance to spend with you talking about it.
Absolutely. A shout out to the listeners. If you are someone who's wrestling with operations right now and you're in that gap of your pharmacy growth where it's like, hey, maybe it's time to investigate a new service. Maybe it's time to reevaluate technology platforms. Maybe it's time to reevaluate what organizations are on the knife's edge of becoming too much of a control freak of everything that pharmacies do. And there's independence in this game, and independent pharmacies don't want to feel like my payer is putting a neck stranglehold on me. My pharmacy management system is putting a stranglehold on me. I want to feel we're in the land of the free. Like, we want to just like move and do what we want as independents. And some independents will use technology slightly different than others. And there's so much flexibility in outcomes technology, as well as the system that I'm not allowed to talk about, which will be the new system that's coming.
Yeah, we're definitely we're building something and we're excited about it. But at the same time, I think it's, how do we take the tools that we had today and how do we continue to make them better? And so we're partnering with ambassadors that we call ambassadors of, folks that are super users of our system, and how do we make things better? And I think the voice of the pharmacist and the voice of the pharmacy is really shaping our roadmap for success. And that's really what the our structure has been, is like, let them tell us what we need to continue to build to help make their days look a little bit easier when they come in every morning.
Yeah. Well, I hate where we're going, but I love the event. Assembia 2026 is coming. We are so pumped up. It's like the Super Bowl of specialty pharmacy. Yeah. You guys are going to be there. Talk to us about what you're excited about specialty pharmacy.
When you think about outcomes, we have multiple different verticals that represent the entire business. And so it's a really great opportunity for us to have our team that is working with pharma brands get a chance to meet with them and talk through how we as outcomes can help promote their brands through access, awareness, and adherence through our pharmacy network. And that can be either through digital programs or also pharmacist-led programs. So it provides us and our team that is working directly with the pharma brands an opportunity to have those conversations and really talk about the scalability of how the outcomes network can help even another type of source, which is the pharma company. So we're really excited about it. We have some new team members that'll be there. We have our support team members that'll be there too, talking about some changes we made across our support organization to really help clients and continue to, listening to them and continue making change within our roadmap. So we're really excited about it.
We're excited too. Your team is going to be almost like the Mission Impossible gang. You guys are going to be going throughout the entire event. I'm going to put your email. You're going to see Nick's email up on the screen right now. It's also going to be in the show notes. If someone's listening and they're like, hey, I want to catch up with these guys, they can just send an email to you.
Perfect. Yeah. I mean, our team will be there. I'll make sure we'll connect them to the right person. But I got to be honest, Todd, you brought up the Mission Impossible. My wife and I, we just watched the latest movie. Have you seen the latest
No, I haven't.
movie? It's 3 hours long.
Oh my gosh.
It takes a whole afternoon, but it was not worth the 3 hours. I don't know if you're a Mission Impossible fan or not.
I am.
It's a long movie.
I tell you what, I remember, makes me feel old to think of the new, Mission Impossible versus, when the very first one that came out. What's this next one called? Is it the Final Reckoning?
It is the Final Reckoning.
Okay. Yeah, it's doing well in the ratings, and people are not very forgiving to older actors. I think there's some ageism there that Tom Cruise is still out there doing stunts. He's still beating it up. And listen, I'm going to be 54 this summer. Wow. So let me tell you what, I'm all Mr. Tom Cruise. Keep doing it, buddy. Keep doing it.
Yeah, you did a great job.
Hey, we're excited that you got to be on TWIRx, be here in the studio. We'll talk to you guys next. Hey, guys, don't go anywhere. More TWIRx coming up.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
Hey, special feature up on This Week in Pharmacy. I want to welcome Jennifer Hammonds to the show. Met you through LinkedIn, and I cannot wait for our listeners to hear your story. But welcome to TWIRx.
Hey, thank you so much for having me.
You're very welcome. We both were at the APHA, but I
Yes.
was busy. I was only able to be there for one day. You were busy running around. We didn't get to cross. But you and I have communicated through LinkedIn, and after hearing your story and building off of what your aunt has built, Sister Bernie Kenny,
Mhm.
the founder of Health Wagon, this is so special, and that's why I wanted to get you on, Jennifer. I want you to share this story with our listeners.
Yeah, so about 50 years ago, a Catholic nun went to the coal camps in the back of a Volkswagen Beetle providing health care and seeing these miners who didn't have any kind of health care. And so she was given a old beat up Volkswagen Beetle and went to the coal camps. And since then, we've grown into freestanding clinics and mobile units that travel across 7 counties. We have a free pharmacy, and we also have a dental clinic as well. And so, what started there in those coal camps now provides a plethora of medical services to an area that has no other options.
Yeah, before we started recording, Jennifer, we're kind of comparing notes, and the area I live in Fayette County, Pennsylvania, Brownsville, Pennsylvania, experienced a massive financial collapse of not only coal working, but also steel. And the community started to really implode in like the 60s, 70s, and then especially 80s, 90s. It was even worse. So you go to our downtown and you see these majestic buildings, banks with marble, and just gorgeous of the age that they lived in through the 1880s through the 1960s. And that's exactly probably what happened in your
Yeah, that's
area.
exactly what we saw here. Coal came in and it, about as fast as it came in, it left, right? And then it just left devastation and no backup plans.
So now we couple that with what the PBMs have turned into, which are, just profit vacuums. And you put that up against the minuscule amount of money that's coming through Medicaid systems and how it's getting worse state to state. So talk to us about the kind of the business model and how you're able to sustain and how the health wagon is moving forward to help people who are desperate in need for medications.
Right. The pharmacy operates, everybody's uninsured, right? Everybody makes 300% below the federal poverty lines. And so we work all the safety net distributors, right? Dispensary of Hope, AmeriCare's Direct Relief. And that's where all of our medications come from. We don't buy any medications. I use my membership for Dispensary of Hope and take that formulary, and that's how we're able to provide millions of dollars of free medications. We also use patient assistance programs. We use every patient assistance program that we can to find a way to get these medicines to these people who have no other options of ways to getting them.
All right, so when you think of these programs and how much the public needs them, you described to me kind of like I don't know if we're going to call it a donut hole, but a section of the population that makes maybe just a little bit too much money to be covered.
Medicare patients, yeah, and that's not talked about enough, right? So like the average Medicare check is $600 in this area. And so most copays are at least a quarter or half of that. And so what are we leaving Medicare patients to live on? There's no cap on that. There's no patient assistance programs because they're technically considered insured. And so the bulk majority of the calls that I get from our elderly patients are ones who have no options to do any better. That there's great, they put a cap on what they can pay. That's 4 months of what they make. That's what they're supposed to live on. The average light bill cost here in this area is around $600 a month.
Jeez.
What are we wanting these people to do when they have no other options? They're going to choose not to take their meds every single time.
Because they have to feed their family, they have to buy food, they have to pay for rent, they have to pay for that electric bill that you said that is, and we know electric costs are also rising. So there's a lot of pressures on you as a provider. Dr. Hammond, where do you see light at the end of the tunnel where you're able to go for new sourcing. I thought of these patient assistant programs, and you've probably scoured all of those, obviously. But is it the private organizations in an area? Is it church organizations? Is it grant funding? Like, where else are you able to?
We're a member of the Free Clinic, right? National Association of Free and Charitable Clinics. They are an amazing resource for us, right? I'm able to pull grants. I write grants. I talk to donors. I will ask anybody for anything if my patients need it. I'll try to find a way. Like I said, if it's not first line, it might not be second line, but there's a line somewhere to put a medication into a patient. Where they live at should not determine their health outcomes, right? This part of the state on the other end of Virginia has a 15-year higher life expectancy, right? So because you're from Central Appalachia, shouldn't determine what access you have. And so that's what we try to do here is build pathways, build every single month. Our adherence here is 85% at our pharmacy because we play up expiration dates. We try to maximize the resources that we have. When we find something in stock that doesn't expire till next month, next year, we will absolutely just try to max that out and get the bulk of our patients on that medicine. When you get into free charity, when you get into free pharmacy, you have to be really innovative in your approach, right? Because it's totally different. I came from a Walmart pharmacy and now I'm running a free pharmacy, right? Two totally different beasts. And so at the end of the day, a prescription is only as good as the medication that you can put inside the patient, right? You know that. And that's what we're doing here. Access, equity. That's all it boils down to at the end of the day.
So when I also think of family planning, or I think of women's health, or maybe something specific in cancer, are your organizations assessing everything, or is there
Everything.
times?
And so there's some cancer medications that we can get through a program called the Pharmacy Connect.
Okay.
And so we're able to search a drug, right? Any drug that you have, we can search and find out pretty instantly if there's a patient assistance program for that medication. And, we take your last year's tax return and we have providers here, we have nurse practitioners here, we'll get you a prescription. We can process that here in-house and we know pretty fast, if we can find a way to get that covered for you.
The mobile units also include primary care, dentistry.
Yeah. And so we have mobile units, 7 counties, about 1,700 square miles is the mission here at the Health Wagon. And so this is all, we're no borders, right? No barriers. And so if you have insurance, we'll bill your insurance, but we provide free services, right? No one ever gets turned away for treatment here.
It's incredible. Where's the opportunity for philanthropy for pharmacists listening in that may either have resources or pharmacists that want to work in this? There's lots of pharmacists out there who are listening who would love to get more into public.
Absolutely.
assistance.
So we do large scale events. And so in July, we'll have an event where there'll be about 2,000 patients here on our campus in Wise, Virginia, where there's always need for volunteers. There's always an education or counseling, or if you have a resource available, we can find somewhere to put you at. Anything that you can bring to the table, we'll find a way to eat.
I love it. I love it. So I want to let the listeners know, I'm going to put this in the show notes. If you want to look this up, it's thehealthwagon.org. Once again, it's thehealthwagon.org. In the show notes, I'm also going to put links to Jennifer's LinkedIn, just in case you want to connect with her via LinkedIn. Jennifer, I appreciate how fast you were able to respond and getting on to This Week in Pharmacy. I really
Thank you for having me on.
Digging into what pharmacists are doing out there to help people that are in different sectors of healthcare. And one of the sectors that we on the show we've been here 17 years and we just don't talk about is the areas of no funding. Like you just have to find a way to get things done. And that's where Health Wagon is serving so many of the communities. And you said 1,700 square miles?
Yeah, and that's the thing. I mean, not only we're a pharmacy desert, right? We're a healthcare, provider shortage area. We have all the fancy terms that, they tell you that let you know that, access is a problem here. We have all that. And there appears to be no answer. That's why it's so important that these safety net programs are sustainable, and it's all because of grit, right? I mean, none of this stuff there's no way to turn a profit on any of this. It's all good old fashioned hard work, grit, and being allowed to talk to people like you, right? That's how we get our message out. That's how we're heard. So thank you for reaching out as well.
Absolutely. All right. You heard it here on This Week in Pharmacy, the healthwagon.org. Look them up. And if you can assist, please do so, especially if you're close by or within an area that you could go over and talk with Jennifer, find out how to help the communities. Jennifer, I want to follow back up with you later in the year and get you back on TWIRx.
Absolutely. Thank you so much.
Thank you.
Thank you.
Hey, we'll be right back with more.